live. All right. Okay, perfect. I'll just let everyone know we're live now. You can give maybe a little bit warm-up time, just so
Okay.
people start joining. I can't seem to see you. What happened?
Um,
Okay, no, leave. I think maybe it's the. Let's see.
yeah. Okay.
That's it. So, all right. Hi, everyone. Just a little introduction. So, this is the continuation of the series that we're doing as part of the IMG Development and NHS Competence Program. This is aimed at, just helping IMGs get the competencies required for the NHS careers. Now, this has become very important now, much more than before, due to a lot of changes from political aspects. And so today, Dr. Shakira Akola would be presenting Safeguarding in Adults and Children. I'll pass on the mic to her. And as usual, type your questions in the comment below and we will take them. Shakira, the floor is yours.
All right. All right. Thank you, Dr. Jonathan. Yeah, good evening, everyone. So today I'll be talking on safeguarding adults and children. I want to believe we can all see the slide. Okay. All right. So in that case, I guess we are like 20 minutes behind time. So I don't know how it will go, but I think I will just come and start the whole presentation. That's fine with everyone. So yeah. Okay. So these are the learning objectives for today. What is safeguarding, understanding safeguarding within the NHS, safeguarding responsibilities, recognizing red flags, knowing our responsibilities as doctors, and how to escalate consent safely. So firstly, what is safeguarding? So according to the Care Quality Commission, that's the kind of regulating body that works with health and social care across the UK. So they actually describe safeguarding as protecting a person's health, their well-being and human rights, and enabling them to live free from harm, abuse, and neglect. So yeah, that's the simple definition for safeguarding. But then while everyone could be prone or susceptible to safeguarding concerns, there are quite few people that are actually more vulnerable, that are mostly susceptible, and those are the vulnerable individuals. Those are children, we have the young people, the adults with disability, or those that need care. And that's why I just have an elaborate one at the right hand side saying who is at risk. Like I said, the vulnerable adults and children. Those are those with learning disabilities and cognitive impairments, including those with dementia. We can also have those with autism. Yeah, they have people at risk. Also, those living far away from home, they are also at risk. Asylum seekers, because they had to leave their country to a new place where they are seeking asylum. You know, they are quite vulnerable because at that point in time, all they have, the instinct they have is survival. So they are vulnerable at that time. Children in contact with the youth justice system has been found to be quite as risk as well. Victims of domestic abuse as well. And those who may be singled out, those are radicalization, that's due to their religion. We see people probably because of their gender identity or sexual orientation. People that are being bullied, they are actually some of the vulnerable groups for safeguarding consent. So, understanding safeguarding in healthcare, here the NHS, the importance and impact. Really, it just states that we just need to ensure the protection of patients and professionals as much as people outside, children and young adults, could be susceptible to safeguarding concerns. Even professionals could also be involved in safeguarding concerns. So, yeah, so it's all about protecting patients and professionals, also promoting the safety and trust accountability within the healthcare system. So, and that will take us to what is the aim of safeguarding? Like, what do we need to want to achieve with this safeguarding as a whole? And the first is to stop abuse and neglect wherever it's possible. So, if you have an inch that any abuse is happening somewhere, the aim of safeguarding is to stop it, to prevent it from happening in the first place. In an event whereby it can't be stopped, then that takes us to preventing harm and reduce the risk of abuse or neglect. So every we want to stop it, but there are times we can't just stop it, but we can prevent the harm that comes with all this abuse. So yeah, that's one of the hints. Another is the safeguard adults in a way that supports them in making choices and having control about how they want to live their life, also to raise public awareness so that communities as a whole alongside professionals plays their part. And that is because I know we would have been hearing something about, oh, this person called social care or they've taken their kids and all. That's to let you know that the safeguarding is not just the responsibility of professionals. The public are also, they can also report safeguarding concerns. So the aim of safeguarding as a whole is to raise their awareness so they can know where to raise these concerns, how to go about it. Yeah. And also, another point is to provide information and support in accessible ways to help people understand the different type of abuse, how to stay safe, what to do to raise a concern about their safety or well-being of an adult, and as well as to address what has caused this abuse or neglect. So there are quite a few county, like every, let's say, more like a local government equivalent. Yeah, yeah, we call them the county. So they have like their different safeguarding protocols or numbers to reach out to. Talk about that data in the slide as well. It's just so that the public as a whole would also know how to report this in case there is any concerns. So yeah, these are the key principles of safeguarding, regardless of whether it's children, young adults, or adults. The principles are all the same. And the first is empowerment. What this simply means is about recognizing that people are experts in their own lives. So the thing is, they should have the opportunity. They need to express what they want and need, especially when decisions may affect them. So this particular principle is actually based on understanding that safeguarding should never take control from an individual except is actually absolutely necessary. So, for example, so if an adult at risk, let's say, for example, reports neglect in a care setting, they should be asked what they would like to happen next. Is it like they want to involve the police? Do they want to make an official complaint? And they should always be presented with all relevant options so that they can decide which one they want to go for of their own preference. So that's what empowerment is all about, meaning they should feel confident and supported in care. They shouldn't be dictated to. The second one is prevention. Prevention simply means we spotting warning signs and also taking steps to address them. And this can always involve maybe training staffs to notice some changes in behavior, maybe someone you've known before for a long time, and you're seeing some kind of behavioral changes, Also to create environments, putting protective measures in place. That's just prevention. And if I'm to use like a care home setting as well, it could be maybe checking the rooms are free from hazards, having policies in place, and also training staff. So that would work for prevention. And I really hope I'm not going too fast. If I am, please just let me know. Thank you. And the third principle is proportionality. And proportionality simply means responding to safeguarding issues in a way that they are appropriate to the level of risk involved. That is, if the risk is very low, because if you now take heavy-handed measures, really, it could cause more harm. And if a serious danger is present, urgent and decisive actions will be required. Um, so that means, for example, if you hear a neighbor shouting in a flat and you just suspect like, oh, they're having a conflict, so yes, that might raise some concern. But instead of calling the local safeguarding team, instead of calling the police, you rather call the local safeguarding team first, because for every county, like I said, they have protocol. Police is like they it might just be something that could be resolved at the local safeguarding level. So that's why we talk about professionality. So it should be appropriate to the individual need, not just the way you perceive them. And the fourth is protection. Protection is the protection actually goes further than just prevention. It simply means when the harm has already happened or is very likely, protective actions should be taken. And this could be maybe arranging a safe house, or giving them the victims medical care, or even involving law enforcement. So let's say an adult in care needs is being financially exploited, for example, by a relative. So protection in this case would be involving the safeguarding team, freezing the suspicious account, and offer support to the victim. So that would be protection. Then the fifth is partnership. Partnership simply means safeguarding, working with people. We share information appropriately, coordinating responses, and make sure no aspect of a person's safety is overlooked. So at times, if you're concerned about safeguarding issue, for example, in the NHS, in order to get a better understanding, maybe it's just an inch, but you're not really sure. At times, you might want to call the GP as well to gather more information. It might not just be we as FY2, it might be something the senior would do, but at the end of the day, there are times you just have to call like different department, call social service to gather information about some of your patients on the ward in order to better understand their predicament, in order to give them the appropriate care. So it's always very important to know how to partnership and work with people outside, like safeguarding people outside. Even schools. So there are times you have to call the schools, or you call the churches, or the religious organizations basically as well, just to gather some information. And the last one is accountability. So accountability just means that organizations and professionals, they should be able to show their safeguarding duties are being met. So it helps to maintain trust between the individual, the community, the safeguarding bodies. And so, for example, if a care team, for example, decide to move an elderly resident to a new facility for safety, then they should record the decision, the information used to make it, and share this in a way that the individual would understand, because that's the transparency and the accountability. They have a record of everything and they are being transparent. So that's what accountability is all about. And those are the six key principles of safeguarding. So now we'll talk about who is responsible for safeguarding. literally everyone is responsible. Every single person is there in school settings. We have the education childcare providers. We have them in healthcare settings, local government, criminal justice, the police, charities, religious organizations. Like every single one is everyone's responsibility to watch out for any form of abuse. And according to the KHAT 2014, which is the legislation for adult safeguarding, basically, it gives duty to all organizations, like every single, as long as it's an organization, that's how serious safeguarding is being dealt with within in this country, to be precise. And NHS, of course, is one of the organization, and that's why for every interview, like even if it's pediatrics or I don't know about surgery and all, but I know there is always a safeguarding questions, and I know most of us have written PLAP too, would have seen some of those questions about safeguarding. I think we'll talk about that more later. So let's talk about type of abuse. So we have some that are quite common to both children and adults. We have the physical abuse. That's where you could always see the scars on their body, bruises, or these fractures and all things you can see physically. Then we have the sexual abuse. We have the emotional or psychological. For children, we have the neglect, we have the female genital mutilation, children's sexual exploitation, fabricated or induced illness. We also have the cyberbullying is also one common one for children. It's not limited. There are quite a lot of abuse, really. These are just a few that I kept on the slide. The adults, other than the physical, sexual, psychological, or emotional, they also go through the financial abuse, neglect, and self neglect as well. For okay, so what are the red flags we could see? Is not limited to these, there are quite a lot. Unexplained injuries. We have career controlling conversations, poor living conditions, financial concerns, inconsistent history in children. And that's why I know, like, for different trusts within the NHS, they have their guideline kind of when it comes to safeguarding. For example, in our trust, like the consultant on call is always like the safeguarding lead in case there is any safeguarding concern during the shift. Then the consultant on call is the first point of contact, your senior to talk to. Then there is always the hospital kind of manager also. I think that I have a slide regarding different some hospitals, the ladder of events. So when we see any sign of like any inch, or we think there might be a safeguarding concern in a child, the first thing is, after taking the history and admitting the child, the first thing they will ask you to do is fill in the CP form. That's the child protection diary, rather. So inside the diary, you're going to put the history, like the way you took everything regarding the history. You're going to just put everything there. The mothers or whoever is giving the history, if it's the mother or the father, you're just going to state it the way they presented it to you, because at the end of the day, along the line, as different people or different department visits them, they're going to take the history again, and they try to look for consistency, or if there is inconsistency, kind of increase the chance that it's safeguarding concerns. In children, we also have frequent or missed attendance. So if when we have neglect, we see more of missed attendance. But when we see fabricated illness, that's when the parents keep bringing the child. Probably it's just a child with allergy or allergic rhinitis, and the mother will say, no, he's having asthma, is this. You get treated, you check everything, the child is fine. The next time school is calling, the child is not coming to school, and the mother comes back to say, no, the asthma is worse. And then you check again, I feel like, what's going on? So yeah, You could see frequent those that's mostly with fabricated illness, while a child that is neglected we definitely miss attendance, miss school, miss GP appointments, in fact, miss health visiting and all because they are neglected. Poor hygiene is also one of those. Yeah, other than the fact that you see they're not all dressed well, some of them will have this bruising or and bleeding from their gum because they have very poor hygiene and poor dental hygiene as well. Yeah, some of them will have fearful behavior. It's not just not playing with friends, but they are very fearful, most especially in the presence of the adults. And some of them probably they are with adult they normally play with, and you just see they started withdrawing from the adult, and yeah, that's something. One of the red flag is disclosure. This is when they actually come to you to tell you about it. And I'm also going to be discussing what you do in this case, what you should do and what you shouldn't do along the line. And of course, we have unexplained injuries, as we always say in Part 2. The lady that said, I think she said she fell or something, then there's this iron mark, or the little boy that had spiral fracture, and then yeah, you suspect something like henny high, because some of these things, them in them, like just one symptoms in itself does not actually say there is an abuse going on or henny high. It all boils down to the age of the child, the mechanism of their history and everything together. Put everything together. And that's why at the end of the day investigate, but that is not the job of a doctor to investigate any form of safeguarding issues or concerns. So, what do you do if you're concerned? The first thing is recognize it, escalate, document, and of course, a referral to the multidisciplinary team, which we're going to be talking about in full. So, what do you do if someone shares a concern with you? Firstly, you need to remain calm. You have to be approachable and receptive. You listen carefully without interrupting, even if they take a break. The normal way they will tell you, give them a tissue, give them water, but do not interrupt at all at any point in time. Make it clear to them that you're taking what they are saying very seriously, and acknowledge how difficult it might be for them to even come out to talk about it. Reassure them that they've done the right thing, and let them know that you are going to do everything you can to help them. Record everything they said carefully. You have to record everything using their words. Put a date and time, and make sure you sign in your notes. And of course, you can also record what has been said or what you've seen or heard, and you take permission from them most times, which they mostly agree to when it comes to disclosure. What you shouldn't do not show any shock or distaste, like, oh my god, no, those do not do that. Also, do not probe or investigate yourself. Like I said, you only listen, record. It's not the job of a medical doctor to investigate. There are people for that, and that's why every trust, of course, have their own guideline in case you have any concerns. Do not do more than what I've stated in the previous slide. So you escalate to the right people, and they will be the one to investigate. Do not ask questions that suggest the answer. Do not speculate or make assumptions. So most times when you're talking to a victim or a patient in this context, you will mostly use open-ended question. Don't say, does that mean you rape you? That's you suggesting or making assumptions. So you can just ask, so what happened after that? What happened after that? I know it's a difficult time. What happened after that? That's more better than just saying, oh, do you mean after that he now did this? That's speculation, and you're suggesting the answer. Do not comment about any of the people involved, even though you know he's a criminal or something. Say, oh, that person is a criminal. No, do not. Do not keep promises that you won't be able to fulfill. And of course, always tell them that you would need to share the information with the appropriate person, because you can't just tell them that their information will be kept secret, because of course there would be an investigation at the end of the day. So If you told them it's going to be secret, then you have to start going back to them and tell them, and they might lose their trust. And do not delay in contacting your safeguarding team. Whatever the time, always make sure they are aware of the developments. Like I said, different trusts, different rules, but most times there is always a designated person you can always report to, regardless of the time of the day, and do not discuss with anyone that does not need to know. So yeah, if there is an imminent risk, that's something that the risk that if you don't do anything at that point in time, it might cause a very significant harm. At that point in time, you need to contact the police or your local service immediately. Don't leave the person until you can hand them over to the appropriate person. You must stay with them and let them know that you're trying to make a referral. And of course, when you're making a referral, you tell them who you are, give them the details of the person at risk, how you find them. Maybe someone wanted to jump over the bridge or something. You let them know this is person, probably is not well dressed. Just tell them the state at which you met the person and what the person have told you. Anyways, probably why they wanted to do what they were trying to do in the first place. And you provide any relevant background information if you do know the patient before, and that's what will happen next. Take the name of the person you're talking to. That's the person from the social service or the police. Their contact details. And then once that you drop that call, then you need to refer to your national safeguarding lead after you have spoken to the authorities, which is mostly in her trust is the consultant on duty. Do not delay. Always let them know as soon as possible. And once you've made that contact with them, they would now be the one to speak to the NHS Leadership Academy National Managing Director. And once the matter has been reported, they're going to create a unique case number, which will be allocated and will be passed on to you as confirmation as the matter is being dealt with appropriately. So that's how to report a concern. This is the example of one safeguarding flowchart. Think this for an adult for a particular trust. So as you can see, is the person in danger? Yes. You contact the community staff or you ring 999 and report any suspected crime to the police. Or you could call any of the other staff, but still ring 999. If there is nothing, ensure the adults and they are not at risk or they are safe. And of course, always preserve the evidence if there is any. Do not start investigation once again. That's how they are just trying to tell you not to do what you're not meant to do. As doctors, we are not meant to start any investigations. Just report. Don't discuss with any other person. Only share information with family with the person's consent. That's why consent is quite important in safeguarding, most especially for adults, because what might be a safeguarding concern to you is not a safeguarding concern to them. And that's why the empowerment part of the principle is actually very important. When they feel empowered at some point in time, even if they've been emotionally abused, to feel like maybe they are the cause of everything that is happening to them. But once you make them feel empowered at times, at that point in time, they realize what has been going wrong and they try to fix it and they give consent to do whatever it is you want to do for their own betterment. So as you can see, they say keep your line manager involved, in charge, informed at all times, and that is the number. They have their hospital safeguarding team. That's the number you can always reach. Once you call the numbers, there's always someone there to pick. And what they do is they try to see is the person at risk from abuse as defined by the Care Act. The Care Act 2014 is like a legal is it a legal requirement or legal policy? It's actually made available to everyone, to the general public, healthcare, everyone. It's just for people to know their rights when it comes to any form of their health or social well-being. So who is entitled to benefit, who is entitled to healthcare, stuff like that. That's what the Care Act is all about. So based on that, they check if the person is an adult at risk based on that particular care act, which is a legal document, then they refer without delay to the social care immediately. I think this for Bristol, yeah. So they refer to the Bristol. The numbers are there. Out of hours, there is also another number. You can also follow up in writing. There's a referral form for that as well, which I'm going to show you in the coming up slides. Complete the DETICS incident form, that's for the doctor, and ensure that the BHT safeguarding team is aware. But if the person is not at risk, based on the Act 2014, then you just refer to the appropriate agency to address any remaining concern and record the decision making and actions in patient record, because transparency and accountability is important regardless. So this is for in children. This is like a flow chart for reporting in children. So once you identify concern, the first thing is, of course, discuss with your senior colleague. They are mostly kind of similar. You discuss with your senior colleague, and then your senior colleague is now going to determine if the child is in need, if it's a child in need or a child in need of child protection. If it's just going to be a child in need, what they do is we admit the patient in the ward, and then we give medical care, of course. Then when we invite the social care, which means the child does not need any protection at that point in time. But then if based on the senior colleague, their assessment, the preliminary assessment itself is quite long, yeah. But based on that, if they feel like there is some kind of maltreatment, safeguarding concerns, then they're going to refer the child to children's social care, and then they will come around, they'll do medical assessment, they will then discuss again with there's always a strategy discussion meeting. It could be in person, it could be over Teams, and from there they will check the section 47 investigation. So at this point, I just need to, I think it's later, it's in the slide. Section 47 investigation is a section of a particular legal document that guides around children's safeguarding. So there is a particular section 47 that talks about how social care should proceed when there is a case of safeguarding in place, when there is a safeguarding concern, what they should do and what they should not do. So they're going to use that to investigate. If it's looking like, then they might have to involve the child protection conference. And once that is in place, then it's either of three things. They will put a child in need plan in place. In that case, the child might still be with the parents, the child might be in the hospital. They will still allow the parents to be in touch. Regardless, it all depends on what the safeguarding issue is all about. But child in need is not like they don't take the child away from their parent if it's in a family setting. But once it becomes child protection plan, they definitely take the child away from the parent, and the child will be with the foster parent or protection. Their local councils, they have places. Then at times it might just be something with legal proceeding. But regardless of the outcome, there is always like provision monitoring. There will be some people that keep going to the house regardless of where the child is, just to make sure that the child is fine. So yeah, that is the way it works in with children. So these are just documentation tips. Make sure you use the patient's words, very important. Try to be as factual as possible. Do not make assumptions. Record actions taken if possible or if applicable, and avoid being judgmental. So this is this is just the front page of a referral form. And this is for Cambridge. Yeah, it's for Cambridge, Petersburg. So if, as you can see, there are numbers there. There is a number there. You can always call, and they can tell you, see, the form within 24 hours of your telephone call. So, and this is also accessible to it's not just medical people, also to the public as a whole. Maybe it's a safeguarding issue regarding your neighbors or so. And this is like 6 to 7 pages. Yeah, this is just the front page. It's quite they will ask you for quite a lot of information. So, how do we meet our responsibilities as doctors? The first thing is to understand and be familiar with the national safeguarding policy. Yeah, we should undertake training to the appropriate level of support based on our role and ensure that it's updated every 3 years. Follow safe working practice, act appropriately, and be able to challenge inappropriate behaviors in others. Be able to recognize signs of abuse, know how to follow and use procedures for reporting concerns, and where there is a rule requirement, ensure that you have a current DBS certificate. And that's why they're always asking for DBS certificates. And if you're going to be working with adults or even kids, they will ask for enhanced, just to be sure they don't have any safeguarding concerns around kids or vulnerable adults. That's how much they take safeguarding very serious. So these are there are quite a lot of acts, legal policies around safeguarding. So the first is for kids is the 1989, which was later updated in 2004. In 2004, it's actually more like they gave the local council more power, like to like, because they are closest to the people, of course, to intervene in the front of safeguarding consent. So before then, it's always like you have to report to national something, national this and that. Then, of course, we have the preventing duty guidance, domestic abuse statutory guidance. There is the multi-agency statutory guidance on FGM, that's female genital mutilation. We have the modern slavery and human trafficking. They are all legal bodies with them. They are all documents we can all access to read about the safeguarding. They talk about what they will do in form of safeguarding, how they carry out their investigations and things like that. For adults, we have the Care Act 2014. There is Care Quality Commission. Like I said, we have some radicalization. That's one of the types of safeguarding where some people are not, they are being, what do I put it, bullied, or they are being excluded based on their choice of gender or choice of religion or even sexual orientation. So we have the Equality Act 2010 for that. There is also the Health and Social Care Act 2008. And of course, 2014 Human Rights Act, Mental Capacity Act as well, because most times most especially for adults, also for children, but mostly for adults, there is always there need to be consent at some point in time, and you need to know if the patient is actually has the capacity to make some of the decisions in their care. If not, it might be overruled. So there are guidance regarding that as well. I think that, and these are the references for this presentation. And thank you. That will be all. Thank you. So if you have any questions.
Oh, amazing. Thank you, Dr. Shakira, for such a beautiful presentation. So you've really gone through sort of lots of fundamentals of safeguarding and different parts, how it works, how it should be applied in practice. Thank you a lot for, and then how it's applied to adults as well as children, in the different scenarios. So, guys, if you have questions, just type it in the chat box, and don't forget to fill in the portfolio, the feedback forms, so that we can send you a certificate, as well as also for, Dr. Shakira's to get your response. So far, nobody has filled the feedback forms.
Okay.
So there's a question for you.
Yeah. I just saw that. So how do you recognize safeguarding concerns in adults, especially if they don't tell you what are the warning signs to look out for? Okay, yeah, there are quite a lot, really. It's unlimited. I think that's the word. That's the word to use for it, because for adults, there are few things. The one that we mostly see, at least in plateau, is always the like unexplained injury is one thing. Let's say patient comes to you now and the patient comes to you now and said they fell down, but then they just or probably they hit their head, and from the bruise they have, you're seeing something that looks like inflicted injury and not just someone an accident, something like that. Then of course that raises a kind of safeguarding concerns. But because you would recognize it at that time point in time, it now depends on them, because adults are really like, we have a mind of our own. So it's now left for you to empower them enough for them to actually open up to say, okay, this is what I'm actually going through. I don't know how you can help me, but I'll be very grateful if you can. Um, Another way for adults is sometimes for an adult, so sometimes you will see probably a person with disability that is not in the mental, like the right state of mind, coming down with pregnancy. That's a safeguarding concern, because you'll be worried, how did this person can become pregnant, who consented to having sex with this kind of person in the first place. Or maybe you see a young adult coming like time after time with things like what's this thing, urinary continence, without a good explanation or probably no surgery, nothing. And you then at that point in time you want to start, because that is mostly rampant with FGM and also like sexual exploitation. And at times you might say, let's see, it might just be probably a neighbor also reporting safeguarding concerns in an adult. And really for adults it's quite a lot, because they would not, most times they would not come to tell you. They wouldn't. They would, because most times they feel like, no, they are the cause, or they are this, they are that, because they've been brainwashed to believe they are actually the cause, while some will later break out of that shell. But those are the few ways you can recognize them, if at all you come across them. Their symptoms, not there is nothing to actually explain some of the symptoms they are having. Then okay, this is a safeguarding concerns. I hope that answers your question. Thank you.
Okay, amazing response. Yeah, guys, more questions? Questions? Don't be shy. Don't be shy. Safeguarding is a very important aspect of not just NHS work, but also very important in getting employment with with other organizations. Guys, so ask away. Okay, so I think people are filling the forms. To make sure you fill the feedback form. It helps us improve the session. It helps us to support the speaker. Also help the speaker to make adjustments. yeah, to their teaching practice. And also do share those teaching sessions so people within your network to make it more
Okay.
richer, so more people attend, and also to make the impact better for everyone. Good. So there's another question.
Okay. What are the cardinal difference between children and adults? Safeguarding, they're not different. Well, okay. Well, when it comes to children and adult safeguarding, what is safeguarding itself? Is just for to make sure people are
What's happened? Hello? Okay. Oh, Shakira is. Good.
network just disconnected. I just realized I was talking to myself. Oh my god,
Oh
sorry
dear.
about that.
Sorry. Okay. Yeah.
Oh
So there was a question from Samuel.
yeah.
Uh,
Okay, yeah. Like I was, let me just start from the beginning because I don't even know when I went off. So what I was saying is, for safeguarding, it's more like we want everyone to be safe, like in their own self, to be free from abuse, to be free from neglect. So when it comes to different, so they you would agree with me that there are different abuse that are actually susceptible like to different age group, like FGM for example. For one, you can't, I don't think you take an adult to do FGM, like it's more like a kid. Children's sexual exploitation is more about the kid. So when it comes to the abuse itself, which is the reason for safeguarding, it's like they are different, peculiar to different people, even though there are some that are quite like that spans across the different age groups. But then when it now comes to safeguarding in itself, the difference would be how we respond. Because, for adults, they have autonomy, they can make decisions on their own. But for children, we have to make sure at every point in time we are more concerned about their safety. So regardless of what the adult think, that's when you see people saying they've taken my kids, they've done this, because the autonomy is not there. As long as the investigation is concerned, they decide for the children, and they make their decision, and they go for whatever it is they want to based on their own investigation. There is no autonomy. There is no, is this what you want? They just act on the best interest of the children. But when it comes to adults, even though the adult is, we are still seeing the best interest, and the adult is saying, I don't want this. At the end of the day, we will just leave, because they have their right to go for whatever it is you as a doctor you're suggesting to them. So I'll say that's the cardinal difference. If I hope that answers your question, really.
Amazing. Thank you, Shakira. So we'll wrap up this session. I hope everyone has found it useful. Do share it wide. The recording will be available for people to go through it, but nothing better than being live. And for those that attend the live, they would be entitled to the certificate for attendance. And of course, those that present and teach will be entitled to certificates for teaching. Just to highlight that you can add this certificate to your portfolio, and I suggest you should, to boost your NHS chances for both training and non-training jobs. Certificates also via Certifier. You can apply, attach them to your LinkedIn, which is one of the features that people are not taking advantage of. Teaching is universal, so bear this in mind when you attach your teaching experience with especially evidences like this. Anyone from any part of the world can see them, and they can hire you. So with that said, I'd like to thank Dr. Shakira and thank everyone that's come today to attend. And then we hope to have another session. The presenter has already been confirmed. Let me just confirm the topic before we call it a day. Yeah, so the next topic is managing complaints, conflict, and difficult conversation. Again, this is a very important topic. So until next time, thank you for attending. Thank you, Dr. Shakira, for such a wonderful presentation. Bye
Thank
now.
you. Bye.
End the stream. Okay.